and we will be discussing feeding development for Is This Typical? This is a presentation that was created and we will be discussing different presentations of feeding tonight and what to expect at different stages. So what is occupational therapy? Occupational therapy works to promote engagement in daily occupations or activities for everyone, and specifically, we're going to talk about infant and children. We work to provide different activities and interventions to work with children in achieving various milestones at different age levels within those activities and tasks that they do. So in terms of infants, babies' main occupations are playing, sleeping, learning about their environment, and what we're gonna specifically talk about today is eating, and that is gonna be considered their primary occupation, especially as an infant. So we're going to talk throughout this presentation about what your baby should be doing at different stages in terms of developmental milestones in the process of feeding development. It's important to remember that these are specifically guidelines and nothing is set in stone, hard and fast. All children develop at different levels and rates, and some areas go faster or slower than others. And so we kind of, like I said, we want to just remember that these are guidelines and not hard limits. Things to consider overall, kind of a little bit of what I was just touching on, is that some kids are going to develop faster than others in certain areas and slower than others in other areas. Most of the time, it all just kind of generally catches up. But when we speak specifically about feeding, we really want to recognize that the foundation that we give our children right from the beginning of life is going to help set the stage for their relationship with food, relationship with their feeder and their caregivers, their overall health, and eventually the entire experience of a meal and snacks and overall, just like I said, the relationship with food. Things like medical considerations and lack of exposure can cause challenges when it comes to feeding, including feeding aversions, intolerance to different textures, and aversion to different flavors, especially in early childhood. So when we talk about feeding and when it really begins, we have to think that all the way back into when the child was in the womb, because that is truly when feeding and pre-feeding skills begin. And they begin with a sucking reflex, which is a natural skill to sustain life. It's maintained as a reflex once the child is born and eventually turns into more intentional sucking between 3 and 4 months of age. So we'll first talk about breastfeeding. If a mother chooses to breastfeed, the baby should be placed near the mother's breast as soon as possible following birth in order to promote learning and to build the bond between mother and baby. Breastfeeding helps to regulate mom and baby's hormones following childbirth, especially if it was a traumatic labor. Babies can typically breastfeed from birth up until 12 months to even 2 years as they wean onto their own schedules. A hungry baby will eventually cry, but they show signs of hunger prior to that point. And some of these things can include bringing their hands to their mouth, sticking out their tongue, licking their lips, and those are going to be some signs prior to crying that we want to look for that's indicating that baby's hungry. Rooting is a reflex that infants have that when their side of their face is touched, that they turn towards the stimuli to find the mother's breast in order to receive their food. This should occur towards the bottle if the baby's not fed as well. Though breastfeeding is recommended, bottle feeding can also provide your baby with the just right nutrition to sustain growth and development. It's important to remember that breastfeeding can be difficult. It can be challenging, whether it's for medical reasons, personal reasons. It's common, especially for your first child. So always keep that in mind and seek help if needed, if this is something that you're, wanting to do. So we're gonna kind of break down stages of development, and then further by age, and then further break it down between breastfeeding versus bottle feeding. So in terms of feeding development from 0 to 3 months, the breastfed baby should want to eat whenever they want, and they should be able to eat whenever they want. You're feeding on demand. Most babies tend to be on their own schedule and eat at between every 1 to 3 hours and sleep in between. It's normal for a baby within their first month to cluster feed. When a baby eats for a couple minutes, they'll stop and then they want to eat again just about a half hour later. The intake, the volume that they will take at any given time will vary based on your child, and it'll change throughout the day and throughout the week. Typically, at the newborn level, volume should be between 1.5 and 3 ounces per feed. When a baby does hit that 3-month age, feedings will remain similar with timing and volume until the baby's about 12 months old and begins to eat food. Bottle feeding babies will still also want to be fed whenever they are hungry, typically on that 1 to 3 hour schedule, similar to the breastfed baby. Different formulas vary, and so the ingredients that they contain vary, so make sure you do your research on what you're looking for and what is in the different formulas. The amount of formula will vary based on your child's growth, and your pediatrician can give you some recommendations and guide you in terms of how much you should be giving. Feeding will become more spread out and increase in volume over time. Typically, babies start off on a slow flow nipple and progress to level, depending on their skill level and various other factors. So that levels of the bottles are 1, 2, 3, 4, and that's based on, the baby's desire and their skill level, like I said. And the right bottle is the one that works for you, the one that works for your baby and they're most successful with. So these are some different positionings for breastfeeding. So they're nice examples here. Just kind of a nice illustration of some different breastfeeding positions, techniques. You can see that some of them require the use of a pillow to help support baby. It's important to make sure that you're bringing baby to breast and making sure that mom is maintaining good posture versus mom leaning down towards baby. And that's where the use of pillows or nursing pillows can be really beneficial. What to do if my baby struggles with breastfeeding? It's really important to expect that there's going to be a learning curve, especially within those first 2 weeks for both mom and baby, and especially with the first child. It's important to recognize that there are lactation consultants available while you are inpatient in the hospital, and then also outpatient as well for follow-ups that you can utilize to improve your breastfeeding skills and experience. It's not as easy as it looks all the time. Some people make it look very easy, but that's not necessarily always the case for everybody. So like I said earlier, seek help from a lactation consultant if breastfeeding is a goal of yours and it is presenting a challenge in some way or another. Your weight will be monitored by, the baby's weight will be monitored by the physician. And it's always important to call a lactation consultant or the pediatrician with concerns and red flags such as baby pulling off the breast, difficulty latching, baby biting frequently, concerns for a slow or sleepy eater, a lot of intense pain, redness, or irritation on the breast for mom, and overall if the baby's just not interested in feeding. Bottles, on the other hand, they all have a different flow rate. So the different amount of milk that will come out of a bottle, formula that will come out of a bottle. So the speed of its delivery is different across all bottles. It's important to note that not all of the speeds are the same, even if the number is listed for a certain age or a certain size. They differ based on the nipple size and shape. So there's wide necks, standard necks, there's orthodontic versus standard nipple shapes, there's flat nipples, there's a lot of different ones, and they all have different properties and different flow rates. So there's some examples of more commonly used bottles at the bottom, Dr. Brown's, Tommy Tippy, Nook, Parents' Choice, Medela, things like that are all kind of common bottles that are used. So this is a little bit challenging to see, but this is the flow rate of different bottle brands. So you can see that there is definitely a difference in how quickly the formula or milk is delivered from that nipple. So if your baby's struggling with bottle feeding, you definitely want to talk to your baby's pediatrician. And these are, again, some red flags to look for. Things like, again, similar to breastfeeding, if they're having a hard time getting a latch on the bottle or retaining a latch on the bottle, and they're losing liquid out of the side of their lips while they're drinking. If they're choking, coughing, gagging, typically that's going to mean that either the texture of the nipple is aversive to them or the flow of the milk coming out is too fast. If they're having a difficult time maintaining a calm state while they're eating, if there's a lot of reflux, those are some things that you want to discuss with your pediatrician. Similar to breastfed babies, bottle-fed babies are also going to have their weight monitored by the physician. And if you're having any challenges or you're seeing these red flags, you're going to want to request an outpatient occupational therapy evaluation just to make sure that everything is looking okay and that you can get any tips or tricks that you need to in order to have your baby be successful with bottle feeding. So these are some of the types of nipples for bottles. There's a vented one that contains a small hole at the bottom to let air escape, which can reduce colic. An angled nipple is going to have angles to one side so it tips easily into the baby's mouth. That's the one seen on the right side of the screen. An orthodontic nipple is going to have a rounded top and a flat bottom, and this is going to reduce pressure on the gums. This one isn't recommended very much, but ultimately, the bottle that is the most recommended, or the nipple that's most recommended, is the one that fits your baby best and the one that they feel most comfortable with and are most successful with. So the next phase is 3 to 6 month babies. And so when we're bottle feeding, we're looking to see that baby is gaining improved head control and neck control to maintain support and unsupported sitting. So looking for their ability to do this in the high chair or on the ground. We're looking to see that they're bringing their hands to midline, so the point of their body right at the middle in order to hold a bottle. We're looking that the oral reflexes, such as rooting, are fading away. They're gaining more voluntary control of the suck-swallow pattern, so it's no longer reflexive. They're actually having control of that. And there's also increased tongue mobility, and this is going to pair along with increased exploration of toys in their mouth. We're going to start looking at the 3 to 6 month age to transition to solids. Typically, a baby's ready to transition to solids at approximately 4 to 6 months of age. If they're showing the signs they're ready to transition, it's typically safe to begin presenting purees. These are meant to serve as guidelines, so it's always important to check with your child's pediatrician for specific guidance regarding your specific child, because everybody is different and all babies are different and pediatricians have different recommendations. So always check with them to see how your specific child is progressing towards that readiness stage. So some general signs that baby's ready for solids. A lot of the new research is showing that a baby's gut isn't ready for feeding until they're generally sitting up without assistance. So a baby needs to have good head control in the high chair. They need to have an interest in what the parents are eating, kind of reaching for food or intently watching others eat. Baby might get excited or lean in or open their mouth when a food is placed nearby. We want to look at babies raking or grasping items with their whole hand that when they're placed on a tray in front of them too. So where to begin? We want to look first at the seating, and we're going to talk more about this in the next page, but keep that in the back of your mind that that's one of the first things that we want to look at. We also want to decide if we're going to use store-bought or homemade puree recipes. Pureeing and freezing fresh foods can improve the natural flavor and preserve nutrients. If making baby's food, you want to pick a good blender and a good food processor. Look for good containers that will allow, safe refrigeration and freezing. And then also look for good utensils and bowls that are appropriate sized for infants. You can store purees for about 2 months if it's frozen, or 3 to 5 days in the refrigerator. We want to consider if there's any family history of allergies. If there are, you want to talk about them to your pediatrician about how and when to introduce those foods. Delayed introduction of eggs, milk, peanut, tuna, and fish does not necessarily decrease allergies over time, according to the American Academy of Pediatrics. We don't want to give any honey before 12 months due to the risk of infant botulism. First foods introduced should be high in protein, iron, and zinc. Breast milk is naturally low in iron, and a child's daily requirement increases at 6 months of age. So we do really want to make sure that we have those high protein, iron, and zinc foods within their diet. There's not necessarily any benefit to introducing one food over another first. It's just, these are just some suggestions that are good first introductions. Next, we want to look at the sitting position. We want to make sure that baby is sitting upright, that they have good foot support and leg support. So over here, when we're looking, this baby's very slouched down. You can see his arms are kind of positioned just at about face level. So he's pretty slumped down, has a rounded back posture back here. This little baby has a lot of room. He can fall kind of one way or the other in his chair. There's a lot of excess room in here, and his feet are just dangling. So these are positions we want to avoid. These positions, on the other hand, this little girl has her feet positioned nicely on a foot plate, and she's sitting nice, tall, and upright with good feet position. This little baby has, while his feet aren't touching the foot plate, he does have support. They're not just dangling freely in the air, and he's got a nice, tall, straight sitting support while he is eating. So what to buy in terms of equipment? We want to look at bottles and cups along with utensils and bowls. So these are all some really great examples of feeding equipment that can be beneficial. So these cups are really nice because of this weight at the bottom. No matter how you turn it, the straw will always stay at the bottom, so they're not going to suck in a lot of air. These cups are really nice. These are 360 cups because they're essentially, for the most part, spill proof, but when you go to drink out of it, a little lip raises with the pressure of the drink and it mimics drinking out of an open cup. Silverware that is small and infant sized is appropriate. Silverware that has these little guards are nice because it prevents them from sticking the utensil too far into their mouth. Ones that have silicone or rubber components to them can also be nice. It's nice on the gums. Ones like these simulate more closely to regular utensils. And then bowls, plates with suction cups on the bottoms are nice because they prevent or at least decrease the incidence of spilling. So some general tips to use while you're beginning solids. We want to start with a single serving food, meaning if it's mixed, it's hard for the child to process flavor. So for example, we want to just eat peas. We want to just eat carrots. So one single ingredient at a time. And we don't want to add things like sugar or salt or different flavorings. When we are presenting the food, we want to present it to the outside of the mouth and allow the child to lean in to show that they're ready for that first bite. Only fill the spoon about halfway and progress to bigger bites as the child ages and shows increased tolerance. When we're introducing a food, we want to wait 3 to 5 days before trying a new food in order to monitor for the signs of allergens. If we were to eat a multi-serving food or I'm sorry, a multi-ingredient food, or introduce several foods in one day and the child were to have an allergic reaction, there are multiple foods that could be the culprit of that allergy, as opposed to if we stick only to one at a time. If there's an allergic reaction, you know exactly which food it was a reaction to. We always want to offer food from a clean spoon and not a pouch. We want to feed from a bowl or another vessel in order to avoid directly contaminating the jar or other feeding bowl that has the majority of the food in. We want to put small servings into other bowls in order to not allow for saliva contamination within those foods. We want to serve food at the temperature that they're meant to be eaten. For example, pureed spaghetti should be consumed warm. And we want to aim for about 4 ounces at first and allow the child to control their appetite. So when we start seeing things like lip pursing or turning their head, pushing away the feeder, things like that, we want to respect that and stop the feed. So there's different stages when it comes to purees, and when we're looking at the different stages, stage 1 is going to have one single ingredient, no chunks. It'll be very smooth, very thin consistency, and then you can add breast milk or formula in order to make it thinner. Progressing from that, stage 2, you're going to begin combining food purees. So for example, sweet potatoes and chicken. And it's going to have a slightly thicker texture and having a couple small chunks in it. Baby has not yet gained total control over their chewing movements, so we don't want to have very large chunks or any chunks that are hard. In stage 3, we're going to have softer cut up versions of what you're having for dinner, so more mashed foods. This can include soft chunks to prepare the child for typical table foods. We always want to be looking at signs of allergies. Things like hives, skin rashes, swelling, problems breathing, bloody or mucousy stool. We want to look for these and contact your physician immediately or go to the emergency room if there is evidence of difficulty breathing. We definitely want to go to the emergency department with those. One of the big things that's talked about is milk protein intolerances, and we want to talk about an intolerance versus an allergy. An intolerance is typically a food sensitivity that can cause your baby to show signs of fussiness and frequent episodes of spit up. An allergy, on the other hand, is an immune system reaction to whey and casein proteins in milk. Your baby may have diarrhea, vomiting, stomach bloating and cramping, mucus or blood in the stool. When a baby has a milk protein intolerance, they will most likely grow out of it by the age of 2. It is recommended that you use dairy and soy-free formula, or if you're breastfeeding, to avoid dairy and soy yourself. If you have concerns about your baby, contact your pediatrician. Jumping to the next age group is 6 to 9 months. And at this point, we're going to start introducing dissolvable solids and sucking foods more than biting is at this stage. So we're thinking, infant and toddler puffs at this time. The child should be picking up a spoon and closing their lips around it to try to remove their food. Early on, especially, we really like to avoid sucking on a pouch. This promotes less precise oral motor skills, and so we really like to use the presentation of a spoon versus directly from the pouch or early on. When chewing, baby's tongue will begin to move side to side. Baby may begin to drink from a cup without a lid with some help. This is an age that you can introduce the sippy cup, and using whole fist to pick up food items is what they're doing kind of motorically at this point. Progressing along to 9 to 12 months, baby's going to begin to use their thumb and index finger alone to pick up small pieces of food, such as dry cereals and macaroni. Baby's going to begin to chew with up and down movements and can use their tongue to push foods to one side of their mouth or the other. They're also maintaining food in their mouth well without excessive drooling or food escaping from their mouth. Babies are typically able to explore new textures such as crackers by biting and chewing them. Between 12 and 18 months, at 12 months, between 12 and 15 months, baby's going to be able to feed themselves with a spoon without losing all the food before it reaches their mouth. We're going to be able to pick up and drink from a cup with some spilling. And they're going to be able to demonstrate a controlled bite on soft foods such as a soft cookie with the front of their mouth. At 15 to 18 months, baby's going to be able to close their lips and chew and swallow most of the time. And they're going to demonstrate a rotary chewing. So rotation with that bottom jaw, not just an up and down movement. Between 18 and 24 months, baby's going to be drinking from a cup without a lid with no assistance or spillage. They're going to be able to manage food on a spoon effectively and to get it from their plate to their mouth. They're eating more variety in textures, so you can be able to see different textures and play around with those. They're going to be able to move food from one side of the mouth to the other without stopping in the middle. Around this age, typically, children will initially open their mouth wide to accept all types of food, and then gradually open their mouth in accordance with the size of the food that's presented to them. Between 24 and 35 months, baby's going to be able to effectively use a fork to feed themselves. They're going to be able to suck through a straw and be able to chew most meats and raw vegetables while keeping their lips closed. Next, we're going to talk about baby-led weaning, which is a technique that involves introducing solids to your baby. It's become more and more popular due to having nutritional benefits, and it also helps your baby's fine motor development and hand-eye coordination. When we're looking at baby-led weaning, baby is in charge of what and how much they eat. Typically begins around 6 months when the baby is sitting more independently. Baby's going to have the same skills as they would for spoon-fed purees if you want to start baby-led weaning with them. They need to have all of those foundational skills. So the fine motor skills we talked about, the core strength and ability to independently sit and have head control and all those things that we've talked about still need to be in place with baby-led weaning if you're choosing to do that. If you do choose to introduce solids with baby-led weaning, food should be served as soft chunks that your baby can use their whole hand to pick up. These can be things like avocados or bananas. Baby should begin with single ingredient foods so you can identify food allergies similar to what we discussed with purees. One of the caveats with baby-led weaning is that while it has many benefits, beginning with spoon feeding purees may still be the best option for babies with any oral motor difficulties or low tone. Solid foods and handheld foods must be supervised at all times. Spoon feeding teaches babies safe food management in the mouth and lip closure. So if you have just, whether general or very specific questions about baby-led weaning, puree feeding, one versus the other, it's always best to just contact your pediatrician for specific recommendations regarding your particular child. So what should be the first foods introduced and how much should you be eating? It does not necessarily have to be rice cereal. I know that was a very common thought for a long time, but it does not have to be rice cereal right off the bat. Soft or pureed fruits and vegetables are great first foods. They'll help your child experience a wide variety of textures and flavors and smells. If you're looking to make your own baby food versus buying pre-made, this is something that's a personal preference. It can be a time commitment, but there are definitely benefits to it, such as increasing nutritional content, decreased preservatives, and it does tend to be more economical. Like I said, it takes a lot of time and can be challenging for storage, and can sometimes just be aggravating. So there are also downsides of making your own purees. So it really comes down to what your goals are and what you're wanting to do and what fits into your lifestyle. So how much food should infants eat? At first, when they are just a couple days old, they're only looking to potentially be taking an ounce for the first few days of life at each feeding. By 2 to 3 weeks, they'll be eating 2 to 3 ounces per feed whenever they are ready to feed, wanting to feed. By 2 months, 3 to 5 ounces every 2 to 3 hours. 4 months, 4 to 6 ounces every 3 to 4 hours. 6 months, if they're taking up to 8 ounces, we'll spread the feeding out to about every 4 to 5 hours. Diapers are a great indication of if baby's getting enough to eat and drink. Infants should wet their diapers at least 3 to 4 times a day, sometimes up to as many as 7 or 8 times a day. Bowel movements may vary by age and formula versus breast milk. If you do have concerns about how much your baby's eating, definitely consult your pediatrician. So looking at how much food a toddler should eat. A good rule of thumb for serving sizes is that a protein should be the surface of a child's palm. Fruits and veggies is the size of surface of the child's fist, and starches is the surface size of a child's fist as well. Choking prevention. It's very helpful if parents and caregivers get trained in CPR prior to introducing foods, and this can be done through caregiver courses with the American Heart Association. Choking is one of the leading causes of death in infants and toddlers, so supervision is very, very critical. We want to cut pieces of small foods into about 1/2 inch or less for toddlers. You definitely want to stay very close by, avoid walking or running while they're eating. Try your best to keep them in a seated position while they're eating to avoid that walking and running, and never let them eat while they're laying on their back. Some foods to avoid at this age are hot dog rounds. You can change the shape of them to make them a little bit of a less choking hazard by instead chopping them into small 1/4 inch pieces. Avoiding tree nuts and peanuts, popcorn, hard candy, cutting grapes into 1/4 size pieces as well, similar to hot dogs. Avoiding beef jerky, baby carrots, you can serve them soft or sliced into sticks. And tough meats such as steak, you're going to want to cut that into very small pieces. So what to do if you've got a picky eater? It's important to remember that it's common for toddlers to go through periods of refusing certain foods. Sometimes your great infant eater turns into a picky toddler because taste buds are becoming more sensitive, and this is normal. We want to look to introduce a lot of variety in our food. And so when we're presenting food, one of the biggest things we can do is try and try and try and try and try. Present different colors, textures, consistencies, packaging, brands, colors, anything that you can do to increase that variety. We want to encourage playing with our food. Getting messy is a good thing. It's encouraging sensory exploration and tolerance. Family dinner time where everybody's eating together is a great way to promote variety in our foods and model appropriate eating, trying new foods, social interactions at the dinner table, manners, things like that. In doing that, we also want to turn off the TV to again promote those same things that I had just mentioned. One of the main things is we don't want to become a shorter order cook where we're making one meal for the family and a different meal for the child. Instead, what we can do is to modify a child's meal to include ingredients that you cooked for yourself. So for example, if you are having tacos for dinner and the child doesn't want to eat tacos, we can change that around. We can have, you know, a disassembled taco where there's a little bit of meat, a little bit of cheese and a tortilla, but not assembled together. We could have just meat on a tortilla. We could have just meat and cheese. We could have cheese on a tortilla. So modifying the existing meal in order to include the ingredients that the rest of the family is eating. And we want to continue to cook with, you know, your familiar family foods. So if you eat different spices, include it with the child's food because those are important for those sensory experiences and the variety when you're introducing these to children. So the role of sensory processing within eating and picky eating specifically is really important. These are all of our sensory systems. So our vestibular system is our relationship with gravity. Tactile is our ability to process and perceive touch. This is a really important one when it comes to texture aversions with food. Auditory is our ability to hear, and our processing of hearing. Our visual system processes our visual input. Proprioception is the relationship that our muscles and joints have with the sensation and knowing where our body is in space. Our gustatory system is our sense of taste, and olfactory is our sense of smell. So it's important to look for different red flags when it comes to our sensory system. So in terms of our touch sense, is we want to look for sensitivity on the face and in the mouth. Do they allow you to have messiness on their hands? And we want to give them a lot of opportunities to explore different textures. So playing in water, in grass, in paint, in sand, in bean bins and rice bins, and just a lot of different opportunities to play with different textures. We want to look at our sense of taste. So we want to monitor if they're overly sensitive to taste, if there's a heightened gag reflex, or if there is a limit in the variety of the flavors that they eat. So they're only eating one category of flavor, or just, you know, they're limited or avoiding one specific category of flavors. And then we want to look at monitoring our auditory and visual systems as well. If there is overreactions, oversensitivity to noise that distracts the baby or child in their high chair while they're eating, a lack of reaction to the feeder's cues when they're presenting food, if they're overly interested in the environment and that's going to distract them from eating. And then overall, we want to look for just overall engagement and conversation and socialization during mealtime. In terms of proprioception, we want to look for and monitor the child who is constantly on the go, can't sustain attention to a meal, can't sit down for a meal. And this is a little bit tricky because this is common in toddlers and it is normal for toddlers. But when if it starts to seem like it's getting more than the norm or it's becoming problematic, that's when you're going to want to chat with your pediatrician. And then next is our vestibular system. If they're scared of movement, such as their feet off the ground when they're in their high chair, or if they prefer to kind of eat on the go, this is going to be something else to talk with your pediatrician about. So when do we want to seek more help for feeding? If they have poor positioning and posture during feeding, if there's frequent choking, gagging, coughing, they frequently get pneumonia, if they have difficulties chewing or munching, or if they are refusing consistencies or textures at that 12-month age, if they're having very, very long meal times where they have poor attention, lack of interest, or extended time to manage their food, to chew their food, or poor weight gain, we're going to talk with the pediatrician. It's going to be important to follow up with them. And then always just make sure that any concerns that you have, you do talk to your pediatrician about at your well visits, or if anything is very, very pressing, make an appointment to chat with them sooner. These are just some educational resources that are good to pay attention to check out if you do have more questions.